Hi, this is Dr. Nick. I'm the incrementalist here with incremental insights for a better business and a better health.
And I'm Fred Goldstein with Accountable Health, working with Nick and others to help companies reopen and operate during the COVID pandemic. Once again, let's talk a little bit about some questions we got from the webinar that we did for the Validation Institute that was focused on universities, but also discussed businesses. And one of the areas that comes up, and I know you've actually gone through the Johns Hopkins course on this, so this is sort of right in your wheelhouse, is this whole issue of contact tracing. So can you sort of start? What is contact tracing?
Yeah, so you're right. I did. I have my certificate. I actually went through the course. I found it useful. It was insightful. It was helpful to sort of, look at it from different perspectives. What is contact tracing? It's the formal process that has been in place for many, many years, to be clear, for lots of diseases. I certainly learned about it in my medical school career around sexually transmitted diseases. That was the predominant place, but it's also for infectious diseases. And it essentially allows us to find the spread of disease and to do so quickly to shut it down. If I was to summarize the sort of key points in contact tracing, identify the individual quickly, and then get to them and understand based on their particular presentation. So depending on whether they have symptoms, a positive test and so forth, we work backwards in time and then try and reconstruct where they've been and who they've been in close contact with. So people that would be deemed a close contact and therefore at risk. And if you fall into that category, we would then reach out to those individuals to try and quarantine them for the specified period. And those dates and durations change a little bit, and it can be a little bit confusing. I don't think it's important for the purposes of that, but that's the fundamental aspects to it.
Right.
And of course, there's lots of other things.
And one of the issues, obviously, as you said, is close contact. You hear people sometimes saying, well, I walked past somebody on the street, so that must be, I must be at risk. And the way it's currently looked at, as I understand it by the CDC, is within 6 feet with or without a mask for 15 minutes or more. Is that the right standard at this point?
Yeah, so that's right. We set some parameters around distance and time because we know that the virus spreads based on the opportunity for transmission between individuals, and obviously wearing face covering is impactful. But it brings up the point about the technology. One of the things that often comes up is, well, we could just put apps on everybody and we track everybody and we would know all this. Well, not so much. And the example that you give is actually a good one that explains why an app isn't so useful. So we just walked by, or maybe we were sat in two completely different buildings separated by a wall, but our technology says, wow, Nick and Fred were actually within 6 feet and they were there for like 2 hours because you sat in Starbucks and I was in my office, and suddenly we're contact. So it requires some additional insight into it. And that's really what contact tracers do, is they apply the human intelligence to it.
And as you bring up, there are a couple of issues around this. You've discussed this and some others, and that is even considering an app and a phone app, it's uptake.
Yeah, so that's a huge issue. Even if you could force people to put this on your phone, and there are certain countries that have tried this, and I pick out Singapore as one that has a fairly compliant population. They didn't get much more than 25%. Ireland was somewhere in the order of 30% or so, and they consider it a success. It's an augmentation tool, nothing more, in my view. I don't think you can compel it. I don't think it's good enough. And there's all sorts of security issues. Gosh, now I've got all of this access. We already saw, not with the app, but in New Zealand, there was an instance of the contact tracing sheet in a restaurant that was used for some male server to stalk a female visitor to the site. All sorts of problems, but we need to get it right.
Yeah, and it's interesting when you bring that up, because we've also now heard from some universities and others that they are in fact using their Wi-Fi systems to identify congregations of individuals to potentially know that there's a group we need to go talk to because they're all standing close to each other. So there is this sort of big brotherish type of feeling to some of that. And we've also discussed some of the other limitations of contact tracing, which is those long, thin chains that we covered a couple of weeks ago.
Yeah, so tell us about that, because that's really a sort of, it's a key aspect of this. When you think about, I think about contact tracing, I go back 2 days. When you talk about long, thin chains, what are you talking about?
Yeah, it's an interesting thought, and something we both looked at now once we saw it come out, which is this concept that while there are certainly clusters that rapidly explode, and you understand there's some asymptomatics, and you pick out the symptomatics, and boom, you know that's a cluster you got right there, and it's happened over a short period of time. But they're now identifying what are called long, thin chains, which are those individuals who get perhaps infected and are asymptomatic, infect 1 or 2 other people, they're asymptomatic, and it just keeps going on until finally you have a symptomatic person. But by the time that's happened, you haven't been able to trace back because it's beyond the 48 hours. So it's another point to an issue we're also have talked about, which is getting to that rapid pregnancy test type approach to identify people on a daily basis, or even more frequently depending, is going to be critical to help address that. And that's why this whole concept that we've talked about, it's reducing risk with as many pieces as you can put in, you know, from the testing to the tracing to maybe rapid testing and other things, the spacing and et cetera, to try to shrink that risk enough to make it safe to be open and operating.
Yeah, and if I was to pick out one specific thing around contact tracing, I would tell you that it is the urgency with which it must be taken on board. If you don't do it as a matter of urgency, you're wasting your time, because the more time that passes between identifying somebody that has the disease and could have infected, the more opportunity it has to spread. So I think the urgency of preventing and tracking those individuals is the sort of key asset. So anybody that takes it on, take it on as if it's a 24/7, 365 activity.
Absolutely. And the other point that raises that we've seen as well and discussed is you don't want to outrun your contact tracing resources. And so ensure you have enough resources in place to contact what might be an outbreak or the infections that are coming on.
Right. Yep. So in line with everything else, it's just one of those features. So, you know, tracing it down, testing, I'd say wearing a mask, obviously, or not. You should be wearing a mask. And, you know, at some point we're getting to the treatment, and that will all add to it. So everything adds in to our capacity to prevent this disease.
Absolutely. It's really a fascinating area to look at, a lot of things to consider. Once again, fantastic week talking with you, Nick. This is Fred Goldstein with Accountable Health.
And this is Dr. Nick. I'm the Incrementalist here with incremental insights for a better business and better health.